Hello, everyone, and welcome to my diversity presentation on healthcare. My name is Jessica Marquis. In this slideshow, we will learn about the availability of healthcare and the health status of different individuals and groups. Two common terms associated with this presentation are as follows: diversity and culture. As defined by the Merriam-Webster Dictionary, diversity is the condition of having or being composed of differing elements, whereas culture is the customary beliefs, social forms, and material traits of a racial, religious, or social group. These terms can often be confused with one another. Diversity is simply differences. For example, the population in the United States is very diverse in terms of race. Culture has to do with groups, such as the racial, religious, or social aspect of life. One might follow a certain culture or ritual based on where they grew up or how they were brought up. Throughout history, life has been changing and altering society. Modern society began in the 20th century and continues into present day. This is all based off of the past, which influences today's world in many ways, such as with healthcare, as we will further learn. There are many benefits and challenges with changing anything in the healthcare field. For example, we have some potential information listed here. Some wonderful benefits that could occur include increased healthcare availability, decreased mortality and morbidity rates, increased tertiary prevention, and decreased sickness rates. However, we can see that there are also potential downfalls or challenges, such as the lack of wanting change and deficient knowledge. The hospitals might make less money, which might turn companies away due to a potential decrease in profit. As mentioned in a study completed by Shanti Mendes and other PhD holders, they concluded that, quote, a significant proportion of chronic disease morbidity and mortality can be prevented if medications are made accessible and affordable, end quote. Mortality rates are also known as death, and morbidity is also known as being diseased. Within this study, they examined 6 low-income countries and found that due to medication prices, the people living there could not afford to treat their problems. Each state has information listed and studies conducted based on health. For example, New Hampshire has a report based on obesity and increased risk for certain diseases. This information is crucial for wherever this information is needed. The target population includes adults, particularly those with low incomes. This is because they are the most influenced, as they are commonly the primary healthcare insurance holders. Children cannot afford or get healthcare on their own. This is why it's important to target the population 18 years of age and older. As mentioned by the Uninsured and the Difference Health Insurance Makes in 2012, quote, low-income individuals make up a disproportionately large share of the uninsured. Close to 40% of the uninsured have family incomes below the federal poverty level, which is $22,350 a year for a family of 4 in 2011. 9 in 10 of the uninsured have family incomes below 400% of poverty and could receive Medicaid or subsidized coverage under the ACA, end quote. In order to see any change in regards to medicine in low-income areas, there must be a multidisciplinary team present. This would include the hospitals, where medications are prescribed, insurance companies, as that is who helps pay for the medications, the medical staff, for knowledge of the medication, surveys of the target population to determine the need to change, and even the government, such as the senator or governor, to help create a statewide or countrywide change. Without these critical components, the task at hand will not be completed. To see any change, there must be a plan in place. There will need to be statistics collected on the population to see the change, such as healthcare availability and income levels. Perhaps even looking at mortality and morbidity rates for comparison. As mentioned in Healthcare in the Two Americas, which was published in 2013, they mentioned, quote, where you live matters. For low-income populations, there are wide differences across states in access, quality and safety, and health outcomes, end quote. Without the proper measurements, nothing can be completed. I would meet with hospital personnel and insurance companies to address the current issues in regards to not getting certain healthcare due to income levels. Maybe by adding in some free clinics or adjusting the costs, more healthcare might be available. Having insurance companies be more affordable for lower income families would also be very beneficial. I would reevaluate my standards and outcomes every 6 months and adjust as necessary to improve patient outcomes. Unfortunately, This plan may not help with the hospitals with lowering costs, but they could get more money based on the fact that they would get more patients in the door. It would appeal to lower income families as they would be able to receive health care at a more affordable price. The Affordable Care Act, as mentioned by the Uninsured and the Difference Health Insurance Makes in 2012, quote, addresses barriers to acquiring insurance coverages through expanded access to Medicaid, subsidies for private insurance, and health insurance market reforms. The majority of the coverage expansions in the ACA took effect in 2014, at which point there is a requirement that individuals have health insurance coverage. The law will also prevent insurers from rejecting individuals or charging higher premiums based on their health status. By 2016, the ACA was estimated to decrease the number of uninsured by nearly half, leaving far fewer individuals facing the health and financial risks that will come with being uninsured. End quote. The more individuals that can receive health care, the better overall health of today's society. Overall, it appears that everyone should be getting the health care necessary for survival, regardless of income. This plan will help reach these statistics sooner rather than later. Thank you very much for watching my diversity presentation on healthcare, and I hope I create more of an insight into the problems that we are currently facing today.